My name is Claire Vajdic. I'm a Professor of Epidemiology at the Kirby Institute at the University of New South Wales. The Kirby Institute was established more than 30 years ago with a remit to eliminate infectious diseases globally, and it does that in partnership with governments, affected communities and health service providers. It led the way in the response to the HIV epidemic, and it's taken a leading approach in other outbreaks since that time. It's based in Sydney. We do research in the region and also globally. A lot of our research has global implications, clinical trials, implementation studies and discovery science at the benchtop. It's critical that we have better data on the cultural and linguistic diversity of the people who are diagnosed with infectious diseases. At the moment, the data we have is limited to country of birth, and we know that that's a surrogate for a person's ethnic identity. We need more data to better understand how we can better tailor to affected communities, because what we're seeing is while the incidence of HIV is decreasing over time, we aren't seeing the same decline in people who've migrated to Australia from other countries. We're seeing pockets where we're not making the same impacts in terms of early diagnosis and prevention. This is the inaugural Australian Multicultural Health Conference, and we're terrifically excited to be here. We get to meet representatives from the various peak organisations, talk about the work we're doing and how important it is for us to build on the strengths of communities and work in partnership with them so that we can target the prevention and health promotion campaigns in a better way so that we get equitable health outcomes for everyone and don't leave anyone behind. For example, in my work I'm looking at uptake of human papillomavirus or HPV immunisation in Australia, and what we want to ensure is that everyone has the same opportunity to be vaccinated and reduce their risk of cervical cancer and other cancers later in life.